Hello everyone and welcome back to my playlist of pathology. Today we are doing another skin disorder which is known as erythema multiforme. It is characterized by epithelial injury mediated by skin homing CD8 positive cytotoxic T lymphocytes. So they are behind the pathogenesis. अभी हम थोड़ी देर में देखेंगे, right? It is an uncommon, usually self-limiting disorder that appears to be hypersensitivity response to certain infections or drugs. So you take certain drugs, you have some infections, and this pops up. Antecedent infections include those congruent infections such as by herpes simplex virus, mycoplasma, certain fungi, and there are certain drugs such as sulfur drugs, penicillin, salicylates, and antimalarial. So this is what usually triggers erythema multiforme, and this is all very high yield because this is tested on your exams, right? The cytotoxic T cells, matlab CD8 positive T cells, attack is focused on the basal cells of cutaneous and mucosal epithelia. So the basal cell, you remember that we had a basement membrane, and the basement membrane ke upar jo keratinocyte ki foreign layer thi, this was called stratum basale. These are the basal cells. Here would be dermis, and then above the stratum basale will be other cells, right, such as stratum spinosum, and then so on and so forth. So this is the attack against the basal cell layers, okay? Presumably due to recognition of still unknown antigen, certain human HLA haplotypes are associated with the disease. So अब तक इसके clinical features पे हमने बात नहीं की, अब करते हैं. Erythema multiforme has a broad range of severity, and this is true for any skin disorder. We talked about in the earlier version, we talked about eczema. Eczema ke symptoms they can range from very mild symptoms to very heavy symptoms, and this is also true for erythema multiforme. The forms associated with infection, which is usually because of either herpes or mycoplasma or fungi, they are less severe. Drug induced are more severe. Okay, so erythema multiforme caused by medications such as sulfur drugs or penicillins, they progress to more serious eruption, and that may lead to sometimes life-threatening condition which is known as Stevens-Johnson syndrome. So this is a very toxic situation जहाँ epidermis की necrosis होके it sloughs off, and the patient then obviously goes into liquid imbalance, electrolyte imbalance. So if this happens, this is very, very serious, and this is usually because of drug interactions and not the post-infectious etiology. Okay, but remember, Stevens-Johnson is a life-threatening situation, therefore it's a medical emergency, and there is sloughing off large portions of epidermis. So imagine somebody taking drugs leading to erythema multiforme, and the reason we call it erythema multiforme that you see red patches all over the skin or in many parts of the skin, hence multiforme. Erythema because it's red, multiforme because it's multiple spots in the body, and if it is severe and because of taking these drugs, then whenever any person develops erythema multiforme because of these drugs, always get worried about Stevens-Johnson syndrome. Keep an eye on the patient. Okay, so here is a diagram showing you erythema multiforme. If you look at the diagram, this is erythematous rash, erythema, and you see there are many of these, right? And this is why this is called multiforme, erythema multiforme, because there are multiple spots. Whenever you see such patient combined with a history of taking sulfur drugs, penicillins, or antimalarials, always consider the patient for developing Stevens-Johnson syndrome. You have to monitor the patient. Okay, it's a very high yield information. Now, affected individuals present with a wide variety of lesions, which may include macules, papules, vesicles, or bullae. They have a targetoid appearance, which means that they're not typically visible here, but they're reddish, and then there is a central palar area. So they have a targetoid appearance. This is very, very important. Early lesions show superficial perivascular lymphocytic infiltrate associated with dermal edema, but the dermal edema is not to an extent कि जहाँ हम इसको spongiosis बोले. Spongiosis is a characteristic feature of eczema. Okay, with time the discrete confluent zones of basal epidermal necrosis occur, and then toxic epidermal lysis or necrolysis, which is what we call Stevens-Johnson syndrome. So all very high yield. So that's all about erythema multiforme, and I'll see you in the next video very soon. Take care of yourself.